Right, hi everybody. I'm sorry for being a little bit late and worrying Conan a little bit. I think if I could just give you a little bit of a background to where I am in terms of my PhD, and ask you to forgive me for the fact I don't have any results or anything just at the moment. I'm actually just started my second year for the PhD, and so far this year I've managed to complete all the paperwork that really does have to be done. And in terms of looking forward, I am really looking forward now to actually starting collecting data. I think it can be very difficult as a student to initially sort of see that that point where you actually will start doing something, and I think that is a difficulty I've had in particular. Right, part of my sort of professional and personal life is a little bit mingled here. Autism is something that I've been quite interested in since my now 21-year-old son was diagnosed with Asperger's when he was 8. And sort of throughout his life, as he's gone through the education system, all those things have become sort of second knowledge to me, if you like, second skin. And you have had to become very much an expert in sort of all the things that are out there, and all the information that's out there can become overwhelming, can be very negative, especially in the initial stages. I can remember the first book I ever read basically said, your child may go to college. Otherwise, you essentially just have to accept that they're going to go and live in residential, which is a very negative approach. And I really did want to sort of go back against that and say, the experiences I've had with my son, and I accept he has Asperger's, in some sense that's not typical of everybody, his behaviours. However, I do like to see that it is a way of going forward rather than looking at the negatives. I like to look at the strengths. So I was very fortunate to be invited to come along with Daz, and a concept that had already been started up looking at adult males with autism in an organisation called the World Autistic Society. And they're somebody who are very keen to use research to actually inform the practice of their practitioners and the clients that use their services. And they very much want this involvement from ourselves, and to be able to say, this is something that we've looked at. Participants are service users, and they are actually the ones who are directing the research as well. Right, so the background, and please excuse all the words and everything, I'm not going to go reading through anything. I think the starting point has been very much about the Autism Act 2009, which is something that wasn't really sort of put out there very much in terms of what was involved. But lucky enough, somebody like the World Autistic Society and somebody like, obviously, John Moores have looked at this and said, right, from a community approach, what is it we can do here that can actually have some kind of impact? And I think in terms of independent living, in terms of autism, there's very much people have these ideas of what autism is, what autism is as opposed to Asperger's syndrome, all these different labels that people have, what do they actually mean? And I think for me, it's to look at autism but from a perspective of service users themselves, who are people who are actually using the services of World Autistic Society, and that might be from an hour a week to 20 hours a week, something that they could actually be using from. They have a very, very good schedule there where they will look at things like social skills, they will look at all those other aspects of the person so that they can develop that person. And what they're looking for, they're very keen to actually identify people there who have had relationships. And by relationships, it's a bit of a loose term, because when I started looking into this, it was very difficult to define what relationships meant. And again, it's about our understanding of relationships. Where do we say a relationship involves X, Y, and Z? Is a relationship something to do with social friends? Is it to do with intimate relationships? And my title at the moment says social relationships, and I am a bit torn with that because it is very ambiguous. But one of my first studies is to actually look and say, in a focus group setting, what is it that people mean by relationships? What do you want to talk about when it comes to relationships? The other part of research I feel is very much under-researched is this idea of sex and sexuality discourses. The vast majority of people, even if it's just people who I've spoken to, or any of the research out there, is very much looking at any kind of sexuality discourses in terms of deviance, in terms of people being asexual, that they're not interested in having a relationship, they didn't know people had relationships. And again, that idea is very disempowering for people who do want relationships. Individuals with autism, in a sense, are handicapped in terms of society, but doubly so in terms of service users who, if some of them are in residential care homes perhaps, then where do they get the privacy from? You know, where's that privacy there for them to actually engage in intimate relationships? And as a society, how are we going to feel about payment towards sex workers, for example? There's a lot of research out there now starting, looking at payments for sex workers and how, you know, basically communities feel about paying somebody for their, you know, somebody who says, right, here's your personal budget and here's what you're supposed to pay, what you're supposed to use it on. You know, should we be doing that? Is there an idea out there that we can actually say, right, that money belongs to somebody, they can, you know, engage sex workers if they want to? Is that then an issue in terms of relationships? So what we're looking at is relationships, really. So I do want to be able to say what it is a relationship means to the person with autism and what it is they can do something about it. Right, okay, so one of the issues in terms of service users then is looking at outcomes, and I think a lot of what we do in terms of research is looking at outcomes. And there is a great deal of research out there that says outcomes for adults with autism are very poor. I think there has been a movement towards getting a great deal of information available for young children in educational settings, and you know, we're aware of what needs to be done, we're putting things in place now, but when it comes to adults, those services are very, very difficult to sort of get any access to, and I found that myself with my own son. So these ideas of employment, social relationships, it's an intrinsic part of everybody's life, relationships, and yet we're saying, you know, essentially that we're defining a group of people who really, you know, don't want a relationship, and when in actual fact we don't know that. We've not actually looked at any research. There isn't any research out there asking people with autism themselves, what do you feel about relationships? How have you managed your relationships? And I think that's what we're looking for, is how do they manage and maintain relationships? Because I think I had a very small focus group, a preliminary group with a group of people at Wirral Autistic Society, and one of the questions I asked is, you know, why do we bother with relationships essentially? If there's so much of a negative aspect of things, and this can go wrong and that can go wrong, why do we bother with them? And in actual fact, one young man who'd not really given much information out, he'd not spoken, he didn't seem to engage with the session at all, he actually just said, because it makes you feel good. And I think in essence that's the bottom line, isn't it, relationships, it makes us feel good. So we need to be able to understand what it is about relationships that may be an issue. Is it the point from autism? Is it the point from service users? Is it a point of the service provision that's out there? So we do need to look at all aspects of that and be able to actually do something, hopefully do something about it. Right, okay, my idea as well was also to look at practitioners, and these are the people who are working with service users who, for one reason or another, actually maybe don't feel comfortable discussing relationships with service users. There are people who maybe don't feel they've had enough training. For one reason or another, they may not actually feel it's appropriate. It may not actually be appropriate, because very much, you know, there is issues there with some people with understanding fully what's involved in a relationship. When I've spoken to staff at the Wirral Autistic Society, they've said they have you know, some people who will just basically regard getting a relationship very much like just going to the shop and buying something, and they want the staff there to provide them with a person who has all the attributes that they want, who they're able to go along with and have a fulfilling life with. So it is very much about their expectations, and staff have said they feel difficulty managing those expectations because they don't really know how to deal with it. And from their point of view, they do really welcome some research that will look at this from the point of view of service users and find out what it is that they could do that will inform their practice. There has also been a great deal of change in the service user profile. There are a great deal of differences, and there is a big change also just happened with the DSMV, because the diagnostic criteria for autism and Asperger's is changing quite often. So you'll have some people who, you know, the vast majority, you know, may have heard of something Asperger's, they may have heard of autism, not necessarily know what the difference is, and yet in clinicians as well, there's a very big difference between these sorts of diagnoses. So it does become very difficult to say what the issues are for people with autism or Asperger's. One thing I have found in the literature is there's very much an emphasis on relationships and individuals with Asperger's syndrome as opposed to autism and any other sort of autistic spectrum condition, because there is a feeling that anybody with Asperger's tends to be a bit quirky, a bit odd, perhaps somebody who can sort of engaged but maybe seems a bit of a professor in the corner or something. And you will get all these which are, even for practitioners, it's going to be very difficult to address the issues when they have very unrealistic ideas of what people with autism generally behave as, or what they expect as well. So it is very much needed in terms of across the autism spectrum. Right, what I wanted to do then with our research is to look at service users and provide them with the opportunity to explore their views and opinions, but have a look at this in terms of past and current relationships. And one of the issues I first had when I approached them or when I spoke to them is they were looking at it as people who wanted a relationship, but that's a whole different question. Because, you know, I mean, you may have seen some of these dating shows on television looking at people with autism and Asperger's. You may have seen a lot of the research out there which looks at, you know, what with somebody with Asperger's and autism, they may prefer online communication. Therefore, there's been quite a shift in terms of people. Internet dating is very useful for those with Asperger's who are able to go online, for example. And I think in some ways that idea is a very big area, whereas what we wanted to look at is how managing and maintaining relationships and what experiences they have, you know, defined in their own way, so that we can say what experiences, how have you managed that relationship, what issues are there, and how can we sort of help you to overcome those relationship issues as well. Also for service providers and practitioners to be able to feel informed with evidence as to what exactly the issues are, and then hopefully they've found a way forward with that. So the objectives then for me was to identify and establish the meaning of relationships as a very basic starting point, because again it is difficult. Relationships in what context? Are we talking about intimate relationships? Yes, but does that have to involve a sexual component? Well, who am I to say that? You know, we aren't in a position to be able to say somebody who has an intimate relationship has a sexual relationship, and therefore we have to start with this very basic understanding of what does relationships mean, how do we define that. What factors then influence their participation? For example, as I've just mentioned about online dating, there is a lot of research out there that looking at communication, taking away from this idea of communication being very verbal. People with autism and Asperger's often feel they have a way of no face-to-face contact when somebody's on internet chat rooms. They're able to project an image of themselves perhaps that they feel comfortable with. They're able to get to know somebody without having those issues of eye contact that could cause a problem. You know, body language, you're going out to a pub maybe to meet somebody is an issue when all you can hear is things going on in the background, or the fact that there's something in the way that you actually can't relax. So that's not going to be a good starting point. So I think that has been something that the influences of participating has really grown. It really has. Right, what barriers are there then that actually prevent adult males from managing and maintaining relationships? From one aspect, that is just, I think that applies across the board to, you know, all individuals with autism, is what problems, in a sense, have they got in terms of problems that they feel are problems as opposed to what we feel are. And again, there's a lot of research that looks at there's a lot of research out there looking at marriages or partnerships between somebody and looking at it very much from a counselling point of view. There is a great deal of research there looking at it, and I think in a sense that's where this has come from. It's been led by relationship counsellors and looking at this aspect of autism or Asperger's and saying actually there's an issue here, somebody, maybe their child's been diagnosed, they've then recognised those traits perhaps with themselves, realise that they may have had a diagnosis, and now there's issues within the marriage, and this is where a lot of the barriers have come from, is looking at it from relationships as well. That's one starting point. So how much more different is it from a service user's point of view as well then? And I think first of all, when I first looked at this, that was the very first thing I thought of, is how can somebody who perhaps is living in some kind of supported living environment, how do they negotiate their relationships then? How do they sort of feel comfortable with having somebody, a support worker there, you know, that in a sense is a proxy for them? You know, how does that make a difference, and how do they manage their negotiate their relationships due to that? And also look at the practitioners, because I think it's very unfair to be one-sided and say, yeah, let's have a look at service users and say, yeah, this is what we need, X, Y and Z. Practitioners, here you go, here's a list, and this is how you're going to help us to do this. When very often a lot of the research has been conducted with practitioners, with family members, and they've filled in questionnaires saying essentially, how does your child or how does the person you know engage in relationships? And there's a lot of research out there looking at that, not from the person's point of view at all. And sometimes families can actually be the biggest hindrance, unfortunately. They don't want to talk about their child being a sexual being. They don't want to deal with issues there where they're talking about masturbation or anything else. And yet in a service user world, this is something that we have to look at. We have to say, if we're looking at this from human rights, from an autism point of view, then the aspect of family life and having a right to family life is something perhaps that we just take for granted. But when it comes to having sort of a barrier there, how much does that make a difference to actually whether we engage or not? Right. The methodology that's being used is something I've not had experience of before, but I must admit it's something that I've really, really welcomed. This aspect of looking at something as participatory research is really, from my point of view, the only way this could have been done. In a sense, there possibly are one or two things that you could twig and say, okay, perhaps individual service users could have come to us and said, right, we want to sit down and define what we want to look at. Whereas, in a sense, we've already come in on that step. So with participatory research, the principles of that are very much about people identifying an issue that they want to change or that they have an issue with, and somebody facilitating that, and that's my role as a researcher, is to facilitate that. But I think with participatory research, the principles of that don't necessarily mean that you have to do the whole package. And we have come in from this as saying, right, yeah, we have a group of people essentially, which takes away that step of recruiting participants. In some sense that's good, in others it's not. But I think the fact that it's participatory actually does help here, because it is allowing us to say, right, okay, from the very basic, what are we looking at? Relationships. What are we going to say in terms of research methods? What are we going to do? And I think this does help me to say that this feels as though it's not me imposing my view. It is very much about being led from the participants themselves. One of the main principles of participatory research is this idea of conscientisation. And I think, apart from getting my mouth around that for the first time, it's worthy. It's worthy of a public health issue. It's worthy of community and society to say, right, research historically perhaps has been done on participants, has been done to better their lives or whatever reasons we have, but to actually what does the participant benefit from that? How can they benefit from that? Okay, perhaps they might have a report, they've been involved in something that has been able to inform practice, but still it's not actually of benefit to them greatly. So for me, this idea of actually looking at it alongside participants, and I will obviously make a bit more sense in a minute when I show you exactly the research methods. If they are able to look at their relationships and say, right, okay, this is what happened, this is why I think it happened, these are the issues that are there, it gives them a time, an opportunity and a space to be able to do that. For us to say, right, instead of going in completely sort of neutral, if you like, and scientific and saying, right, okay, tell me what your experiences are, I go away, I do an analysis of that and say, yes, this is what I think your issues are. How does that benefit them? In a sense, this is a way of saying, does it need to be improved? Perhaps it doesn't. If it does, then how do we go about improving it? And this idea of the quote at the bottom there, is exactly something I think does depict the whole sort of encapsulates participatory research, is that being involved in analysis does allow you to reflect and say, actually, this is how I am able to change it, if I so wish, and it improves their reality. So the idea of PR principles, as I've just mentioned already, is to look at my role as being a facilitator, as being able to say, once we've decided on, or once we've agreed on these issues in terms of what we want to look at, we're going to say the main point of the research is to work alongside participants who are service users and ask them to give me the information that they feel will be necessary so that they can actually talk about their experiences as well. A qualitative approach, I think, is necessary here. However, the issue here, though, is in terms of people with autism are not necessarily able to access language-based research methods all the time. So part of my role is to also look at other alternative methods as well. And that is something I was quite keen to look at in terms of computers, iPads, apps, something like journals maybe, to keep an idea of you know, what works best for that person. So what research methods, and that's again part of our focus groups, is looking at what research methods will maximise participation in a way that is useful and beneficial to that participant. So phase 1 and phase 2. Phase 1 is essentially focus groups, primarily with service users, looking at all those issues I've just talked about. Phase 2 is to look at interviews or other alternative methods. There is some research there looking at journals, looking at somebody doing a diary, which is a very, very useful way as well. So again, it will take this idea from the research design goes from a collective experience to individual experiences, which I think is quite opposite to what a lot of research does. A lot of researchers come from, you know, the focus groups are the end product and the interviews are the first. And I think in this way, because of the principles of it being beneficial to the person, are ideal for this. Right, so there's service users, practitioners in phase 1, interviews are service users. So there's a breakdown really of all the different studies, which I'm sure we can go over. Again, I've already talked about the idea of conscientisation in the analysis. So there isn't a separate entity, there isn't a separate, right, okay, I've got all the information here, I sit down and I highlight which I feel are themes in here. It's actually done alongside this person, which can be an issue in itself with ethics and an issue itself in terms of providing, you know, the sort of preempting all this. It's very difficult to be able to say, right, okay, how am I going to deal with this? So that is something that will have to be ongoing in a sense, to be able to look at that and say what issues have come up as well. Right, benefits though I think will be hoping to be a sharing of views and opinions with others, so to increase to reduce isolation and increase support networks, looking at and exploring their own personal experiences and becoming self-aware and gaining some insight from that as well. Also, hopefully practitioners and service providers will find some benefit from, you know, a report hopefully we will negotiate at the end of this as well. Right, okay, so there's my summary. There's a paucity of peer-reviewed research on the experiences, and there is a concern because of the Autism Act that really we're not doing enough, and we're not doing enough because we don't know enough. You know, we really do need to be able to increase our understanding, but also do that in a way that is beneficial to individuals with autism themselves. Right, references, and anybody any questions?